Hello, everyone. Good evening. Thank you for joining us this evening. We have quite a few people connected, some healthcare providers, probably patients and others interested in obesity problems. So let's get started. At the end of this presentation, we'll try to answer some questions. So please send your questions while I'm talking. In order to send me questions, you will need to be logged into zoom.us webinar application. First of all, I want to thank Vita.G company for sponsoring this webinar series. Today I will talk BPD duodenal switch operation, the operation which is very important part of our bariatric surgery repertoire to battle obesity epidemics. So next month I will try to cover some more topics such as duodenal switch complications, nutrition, and others. You can watch webinar on Facebook Live, on Vita.G Supplements Facebook page, or you can watch recording later. Also, you can watch recording on Vita.glab.com. I am board certified surgeon specializing in bariatric surgery. I have performed about close to 2,000 bariatric operations. One of my biggest interests is duodenal switch operations, especially its metabolic effects. I believe duodenal switch, or some sort of variation of duodenal switch, will be operation of choice not only for weight loss, but also to treat type 2 diabetes. Obesity has become a major health problem, not just in the United States, but also all over the world. We have reached the point where nearly 38% of all adult population in the United States are obese, body mass index more than 30. And nearly 8% of all adults are extremely obese, body mass index more than 40. The causes of obesity are complex and include individual, social, and environmental factors. Our portions became bigger, food quality became much worse. We have more processed food, less nutritious whole food, less activities, and obviously more sedentary lifestyle. So why obesity is the problem? Well, it causes obesity-related medical conditions, and especially type 2 diabetes, heart disease, strokes, actually even certain types of cancers as well. It is also very costly. It is calculated that obesity costs our nation more than $149 billion each year. To treat obesity similarly as with any other chronic metabolic conditions or any medical conditions, we implement medical and or surgical options. So medical options usually are obviously the first, such as behavior modification, lifestyle changes, physical activities, medications, medical devices. So every month or two, we have new medication coming up or new medical device. Now, unfortunately, with medical treatment, this is kind of short-time solution, and it's up to 90% of patients within 2 years, they would regain weight. Now, currently, surgery offers the only viable option with long-term weight loss results and long-term weight loss maintenance. And especially BPD duodenal switch is one of the most effective operations. Now, the other options such as vertical sleeve gastrectomy, Roux-en-Y gastric bypasses are very popular options as well, and gastric banding somewhat is already disappearing. Now, there are some multiple variations of Roux-en-Y gastric bypass and at the same time BPD duodenal switch variations. Least common operations would be the new under research protocol medication, the operations such as duodenal jejunal bypass or ileal transposition. Now, before we start talking about effects and results of BPD duodenal switch, we need to define the BPD duodenal switch as an operation. A lot of times, even in the literature, there is quite some confusion, and a lot of different operations is mixed up together. So before we start looking into anatomy of BPD duodenal switch, let's talk about normal GI tract anatomy. So normal GI tract consists of long tubing system. It starts with mouth and ends with anus. In between, there is esophagus, stomach, small bowel, which consists from three parts. First portion is called duodenum. Second portion is jejunum, and third portion is called ileum. And then you have large bowel. So in this picture, you see just a rough depiction of all these parts of the GI tract. We as surgeons have very special privilege in our lives. We are allowed to cut organs. We can restore what's been damaged, and we can do it all with very small incisions. That's why recovery is really fast. So the surgeons, we are plumbers, scientists, we are butchers, we are engineers, and many other specialties in one. So how in the world did we come up with this biliopancreatic diversion with duodenal switch? Well, let's go back to 1979, when Dr. Nicola Scopinaro from Italy noticed that after removing portion of the stomach for other reasons, such as ulcers, tumors, cancers, and reconnecting with the small bowel, patients would lose weight. So he adjusted the distance between connections and introduced biliopancreatic diversion. And this operation was designed for weight loss. This procedure combined malabsorption with gastric restriction. So removal portion of the stomach was important part of the operation, and that the removed part of the stomach was a distal portion, which is last portion of the stomach, including pylorus. The pouch was quite large, about 250 to 400 cc's, and it was connected directly to the small bowel. So the distance from the first connection, which you see on the picture here, to the second connection is called the ruling. The distance between second connection and a large bowel, it's called common channel. In Dr. Scopinaro's operation, common channel is short, between 50 to 75 centimeters. This is an important point to understand because the common channel length will determine how high is the likelihood that patient would develop malnutrition complications. The shorter the common channel, the more likely that malnutrition may happen. Now, almost 10 years later, Dr. Tom DeMeester developed standalone duodenal switch operation. So this operation was not for weight loss, but was mostly designed for bile reflux. This is when bile comes up in the stomach where it's not supposed to live. So by diverting it with this type of reconnections, bile never comes up back into the stomach. So very similar reconstruction as you can see here in the picture. You also have BP limb, which is shown in green here. So you also have roux limb, but notice one big difference. The stomach is preserved in its entirety and including pylorus. So the pylorus is the natural valve at the end of the stomach, and it regulates smooth transition into the smooth transition into the small bowel. So notice that this, in this operation, stomach is entirely preserved. So about a year later, Dr. Douglas Hess modified the original Scopinaro operation, and he combined that with duodenal switch. Now this hybrid procedure now is called biliopancreatic diversion with duodenal switch. So in this operation, instead of distal gastrectomy, now we have sleeve gastrectomy. And this sleeve gastrectomy actually preserves pylorus. Now we have much more natural food transition into the small bowel, preventing from dumping food directly into the small bowel. Please keep in mind that what is referred as duodenal switch operation is quite the mix of all types of operations, especially in review articles. BPD duodenal switch without, BPD, bilipancreatic diversion without duodenal switch, or otherwise known Scopinaro procedure, could be together mixed up with this standard BPD duodenal switch with duodenal switch, and different length of common channels also could be included in the same in the same bucket. So it is very important to understand the differences between these operations and not to put them together when we are making conclusions about the results. Now, the advantages of this standard BPD duodenal switch operation, which is shown here on the picture, is that we have less ulcers, less stomal strictures, and we have no dumping syndrome with these operations. Now, some of the newest versions of what is also referred as duodenal switch is the loop duodenal switch operation. Also, this operation sometimes is called SADIS, which is single anastomosis duodenal ileal bypass with sleeve, or also known as SIPS operation, or stomach intestinal pylorus sparing operation. In this operation, we still have pylorus, which is good for any operation, but biliary pancreatic limb, which is shown here in heavy green, is not constructed as Roux-en-Y anastomosis, but rather it is left as a loop, such a way that it's creating long common channel. This is newest member of the family, so there is therefore data is not really very conclusive as of yet. Now, all bariatric operations are designed, and not just duodenal switch, but all bariatric operations obviously are designed to have some weight loss effect. Now, besides that, these operations are very important also in resolving some specific medical conditions, such as diabetes, hypertension, high cholesterol, or obstructive sleep apnea. The weight loss mechanisms in BPD duodenal switch are mostly based on restriction, which basically means smaller stomach, less food, less calories, and diversion, or sometimes called malabsorption, because food is traveling now much shorter distance, and therefore shortening time for calorie and nutrient absorption. So mechanism for resolving diabetes and other metabolic problems, such as high cholesterol, hypertension, are a little bit more complex. There are two main theories actually how these metabolic problems are resolved, is foregut theory and hindgut theory. So foregut theory basically says that bypassing first portion of the small bowel, possibly we preventing some kind of magic signal secretion, actually promoting or causing diabetes. Now, in hindgut theory is something to do with the last portion of the small bowel, and basically this theory says that expedited delivery of nutrients or nutrient chyme to the distal intestine, which is the last portion of the small bowel, enhances some signals, improving insulin sensitivity and production, therefore resolving diabetes, and in turn actually also improving cholesterol and obviously cardiovascular profile as well. Now, let's go back to our practical part of the talk and look into how much weight we actually expecting to lose with these operations. And also we're going to look into how high is the likelihood, or what are the chances that your metabolic problems such as diabetes is going to be resolved after BPD duodenal switch operation. Now, first of all, there's no uniform system how to calculate weight loss, and you will find variety of options when reading literature. So please pay attention how they calculated their weight loss, because it could be somewhat confusing if you look into percentages and they just not going to match whatever you actually know. So if you're gonna know what you're looking at, so then you're gonna eliminate some confusion and better understand really results. So some people calculate total body weight loss, which a lot of times is in European studies. Others calculate percentage of excess weight, and others calculate percentage of your body mass index. Now, most surgeons in the United States are using percentage of your excess body weight. Let me walk through this calculation just to make sure you understand how we calculate weight loss. So first, we determine what is supposed to be your ideal body weight for your height. So this is taken from these predetermined tables. Then we subtract your ideal weight from your current weight. And let's say if your ideal weight is supposed to be about 150 pounds and your current weight is about 250 pounds, your excess weight will be calculated about 100 pounds. Now, with most bariatric operations, you are expecting to lose from 60 to 80% of your excess body weight. With BPD duodenal switch, your expected weight loss is about 80 to 100% of your excess weight. So if your excess weight is about 100 pounds, you would be expected to lose from 80 pounds to 100 pounds, usually in about a year, year and a half. Now, weight regain is another big advantage of BPD duodenal switch. The chances of regaining weight is very small, only a few percent. Now, BPD duodenal switch results overall are very consistent in resolving metabolic problems. And these metabolic problems, as I was mentioning before, is type 2 diabetes, high blood pressure, high cholesterol. So resolution of type 2 diabetes with BPD duodenal switch ranges from 95 to 99%. High blood pressure resolves in about 83–85%. Resolution of high cholesterol is up to 99%. So I've seen multiple times patients with diabetes who are a lot of times having very difficult time to control their diabetes, even with 2 types of insulin, and they take also oral medications and still cannot control their diabetes well. And after surgery, sometimes even in 1 month, they do not need any medication, and they are actually completely with normal sugars. So obstructive sleep apnea resolves in about 90%. In conclusion, BPD duodenal switch operation is the most effective operation for weight loss. But the most importantly, the BPD duodenal switch is the most effective operation for metabolic syndrome, and especially for type 2 diabetes. So resolution ranges from 90 to 100% in these operations. Now, you need to remember, as with any treatment, possible complications and side effects must be discussed with your surgeon or your doctor. Now, thank you very much for participating. Now we'll try to answer some questions. Let me look what questions we have. Okay, so one of the questions is, BPD duodenal switch is very effective operation. Why this operation is not the most common or most popular operation? Well, there are a few important reasons why this operation is not the most common and most popular operation. Now, one of the reasons is that this operation is very complex operation. So it is operation which sometimes takes 3 or 4 hours to do, and most of the surgeons in the United States would prefer rather to do some short operations. Instead of doing just 1 BPD duodenal switch, they may want to do 2 or 3 sleeve gastrectomies. The other important point is that because of complexity, the training is not as easy, and not too many surgeons are trained to do these operations. And their last but probably most important thing is that you need to have really good support system to help these patients actually after surgery, to make sure they are following with their supplementation, they're following their labs, and making sure that everything is adjusted as needed. So these are probably the most important reasons why this operation is not the most common or most popular. Now let's see, maybe we can pick another question. So are these operations performed with minimal invasive techniques, and how fast is recovery? Yes, BPD duodenal switch operations are performed with minimal invasive techniques in most of the centers. I personally prefer a robotic approach. The operations may take 3 to 4 hours, as I was mentioning before, but recovery is amazingly actually really fast. Length of stay usually in a hospital would be for most patients just 1 night. But 1 or 2 nights is actually very short length of stay. Now, back to regular activities, most people go back in about a week or 2, and usually we recommend patients not to lift anything heavy for about 4 weeks or so. So basically, you're back to absolutely normal life with even intensive training, physical activities in about 1 month. So we're running out of the time. There are so many questions, but I cannot answer all of them. So I hope I introduced some clarity about duodenal switch and why patients choose duodenal switch in general. So remember that choosing operation is not an easy task, and it is also depending on other multiple factors such as your medical condition, your body mass index, and also surgeon's expertise as well. Always discuss that with your surgeon, and good luck.